Thank you, Mr. Chairman. Substance abuse disorder continues to be a public health crisis, as we have heard. It affects millions of Americans. But as disheartening as the numbers can be, it's important to remember, as we heard from our colleague, Mr. Reed, his compelling testimony, that there are good people and organizations that strive every day to help those recovering from substance use disorder. In my district in Buffalo, New York, Save the Michaels of the World is a not-for-profit that works to educate communities about substance abuse disorder and provide support and resources for individuals with substance abuse disorder and their families. Save the Michaels was founded by Avi and Julie Israel after their son Michael died by suicide after struggling with opioid addiction. When it comes to treatment and to treating substance use disorder, and in particular opioid use disorder, we know a great deal about what works and what does not. Medication-assisted therapy, of which 1.4 million Americans are now seeking, in conjunction with therapy and community supports, offers the best chance for folks recovering from opioid use disorder. Medication-assisted treatments are controlled substances, and we should be thoughtful and deliberate in how we regulate. But providers wishing to offer medication-assisted treatment face a complicated web of reimbursement and regulatory guidelines that can be difficult to navigate and can make medication-assisted treatments financially unsustainable. Diversion and abuse of medication-assisted treatments is a real concern, but evidence strongly suggests that if you want to reduce diversion and inappropriate use of medication-assisted treatments, the solution is to make them more accessible and get more patients into treatment. Dr. Chapman, can you speak more about your experiences with navigating the rules for administering and being reimbursed for medication-assisted treatments, and how we can increase access to them responsibly and make the progress of administering, paying for, and disposing of them less confusing for providers? Dr. Chapman.
Thank you for that question. From my perspective, expanding medication-assisted treatment is going to be the key to curbing this epidemic. We know that opioids, unlike any other addiction, has a 90% relapse without treatment. And the problem is that it so closely mirrors our own endogenous dopamine system, our feel-good system. We know now that there's a genetic component to it. A young person may break an arm or sprain an ankle and go to the emergency room, and with that first dose, feel different and feel that this is the greatest thing that ever happened. On the other hand, I'm allergic to morphine. So we can see that there's this wide spectrum of how each of us responds to these medications. So medication-assisted treatment needs to be available to anyone and everyone in the country. We know from our experience that if we leave pockets of patients untreated, that drug suppliers and patients will find each other, so that we cannot leave any community untreated, any person untreated. So I think free access, similar to France and Portugal, where they had similar problems 20 years ago at the same time that we did, and they turned to medication-assisted treatment with methadone and buprenorphine, and there was a dramatic decrease in crime. There was a dramatic decrease in AIDS and hepatitis C. And of course, there was a dramatic decrease in overdose deaths. So we know from international studies that because of our system, our fragmented system, the fact that we don't have universal health care makes it very difficult for us to penetrate and replicate what we know works in other countries where they do have universal health.
Thank the gentleman.